So we'll go ahead and start with the recording, and I just shared a little bit of information, but today we have recorded Caroline Hawthorne, who's pastor of Hunt Memorial United Methodist Church and is the director of Proverbs 327, which serves homelessness as day shelter on Mondays and Fridays. So you'll hear her talk about that on our YouTube channel that I'll put in the chat, and I will be sending that out by email. We have several of our past meetings, and including Salvation Army, Haven of Rest, Family Promise, and the last one in December was Eric Fields with it was servingtricities.org. You can still find it that way, but it's Here to Help, a resource guide online that Summit Companies has helped to put together. Thank you, Jamie, for putting your information in, and you're encouraged to put your name, your agency, email address. And I'll share the chat back through email. So if you don't capture all of it, you'll have it. And we will have, after the program, we'll share information as much as we have time for. So that's our usual format, is the program and the information. So Caroline Hawthorne is unable, she works on Friday. They're open on Friday. So it's hard for her to get to these meetings. So I met with her. We did a Zoom recording of her talking a little bit of my interview and asking questions. So this is the first time for me to try doing this, but we are going to share the screen and watch the YouTube. I think it's like 25 minutes. So we'll watch that together and then be able to share after that. Does anybody have any questions or comments before we get started? All right, so we'll learn a little bit more about Proverbs 327. And let me know if there are any problems. Well, hello, Pastor Caroline Hawthorne. We are so glad to have you with us today. As we spoke before, we've had folks come from Salvation Army and Haven of Rest and Family Promise, and now Hunt Memorial United Methodist Church that does Proverbs 327 and is in partnership with those groups. So we're so glad to have you, so you can talk a little bit about what Proverbs 327 does and how it serves the community. And I know we talked that those groups, y'all, Family Promise, Haven, and Salvation Army, are the folks in our community who have pretty intense direct contact with folks who are experiencing homelessness. So we want to welcome you today and also say that you are a pastor and you're also working on further degrees at the same time as doing some of these things. And also want to just note, I know you've gotten different accolades, but in 2022, WJHL recognized you and made you famous for the Remarkable Woman program that they had. And we're so proud that you're in our community and doing this work and working with your volunteers and church members. So if you can go ahead and talk with us, and I might interrupt and ask you to say a little bit more or ask a question. We're not able to have you live for folks on today to be able to ask questions. So I'll try to think like folks and see if I can help with that. So welcome,
Okay.
and tell us a little bit about your program and your mission and what y'all do.
Okay. Again, my name is Caroline Hawthorne. I am the pastor at Hunt Memorial United Methodist Church, and we oversee the Proverbs 327 mission, which is a homeless day center. And we are open on Mondays and Fridays from 9 a.m. to 3 p.m. And we kind of bookend what Family Promise does out of the Salvation Army and work but I mean, it has been a really good partnership, and been able to work with her, with the people at Family Promise and Salvation Army and Haven of Rest and a plethora of organizations in the Bristol community. But the typical day here, that would probably be the easiest way to do it, is folks come in and we do serve a hot breakfast. It is usually oatmeal, but the people love it, and we then they will take showers. They can do we do their laundry. They can sign up to have their laundry done. We do also offer a clothing closet, and we do give out blankets if they are needed, and try to keep socks and undergarments as well, coats, gloves, hats, everything that is needed. Um, Also, we do give out hygiene items, and one of the things that I really enjoy um, is being able to have one-on-one contact with some of these folks. You know, they do see me as a pastor, so they will come in and even ask me to pray with them, or ask me to pray for a situation, or you know just sometimes they just need somebody to listen. And we have wonderful volunteers as well, and so they are wonderful listeners as well. It's crazy. A couple of weeks ago, we were talking about how in the Bible it says that we are supposed to support our widows and help our widows. And we were just trying to do a little inventory here, and we noticed that out of 8 of our women that volunteer here, 6 of us are widows, myself included. And it was just kind of neat to see that the widows are the ones that are taking care of our homeless. I'm not saying that that's the only ones, but it's just a neat statistic to see that. But some of the women here, and even some of the men, have kind of adopted some of the homeless people, and have been a mentor to them, and kind of walked with them, put them under their wing, and offered a little bit more assistance than we normally do. And by that, I don't mean financial assistance, but I just mean guidance. And so it's a really neat program. We also will help, as Family Promise does, with birth certificates and IDs and social security cards and food stamps. And we tend to help people more on the Virginia side, since we are on the Virginia side. And Family Promise, if I have somebody with Tennessee, I say go talk to them at Family Promise, because I don't really know as much about Tennessee. But then we offer a lunch, and it's usually a hot lunch. And before we have lunch, we have a devotional time, and this is really a good time for us to just be more about our Christian mission. And most of the time it leads into a short little discussion. I don't try to push the issue or anything, but we usually end up having a little discussion with them about God, and just try to be our Christian disciples as well to others. But one of the things, when we first started doing this, we were serving the children of the Rice Terrace community, because that is the area that we are in. And I had a little girl come to me, and um, she asked me one night, she said, "Do you happen to have any blankets, Pastor Caroline?" And I said, "Yeah, I think I do." And at the time, we didn't really keep blankets, but I had gotten some as donations for Christmas presents in case children needed blankets for Christmas presents. And so I went and I got her one, and she said, "Can I have one for my sister?" And I was like, "Yeah." And so I got one for her sister, and it just kind of caught me off guard. And I said, "Are you needing more blankets?" And she said, "Well, we might." And she said, "We got evicted." And I said, "Oh." And I said, "Well, where are you staying?" And she said, "We're staying in our car right now." And it was a mom and dad, two brothers, two sisters, and I think three dogs living in a small car. And I kept thinking, "Oh my goodness, that's miserable." So I called some of the church people, and I said, "Hey," I said, "can we just offer them a meal tomorrow and let them sit in the church so they can get out of their car?" It was during Christmas break. And so, some of the church people were like, "Sure." And so we did. And we did that for 2 or 3 days. And this is a family that had been through the Family Promise program at that time that was in place. And, but they, had found themselves once again evicted. And so we tried to help them think of how they could remedy this situation. And, we did that. I wouldn't say we did it every day during Christmas break, but it was a lot during that Christmas break time that we came in and fixed them a meal, and it just started something beautiful. It made me realize that the church had a passion to serve, and what could we do to be more like Christ. And so that really led to the inception of, us opening on a regular basis. So for me, it has been just eye-opening. I I never realized how many homeless were in our area. And since our inception, those numbers have grown drastically. We have seen an increase, especially these last probably 6 months. The numbers just seem to be increasing even more. And here lately, and we aren't seeing like your typical homeless person, not to put any kind of characteristics on them, but we are seeing more people that are elderly or disabled that are losing housing because their rent is going up, or other situations. And so that is really heartbreaking for me as well, because these aren't people that you typically would see. And it's really hard. I mean, this, I there we had an elderly lady, and I kept thinking, this could be my mother. I mean, this situation could happen to my mother. And so one of the things that I even have been trying to think of is what can we do to help with affordable housing, and what is out there that we aren't seeing. Another thing that I've also been trying to figure out and wrap my brain around lately is how to keep people in housing once they get in it. Because some of our folks, we've noticed that once we do help them find housing and get into housing, they have no idea how to live in a house. And so they lose it fairly quickly and get right back on the streets. So there's not like a program, or not that I know of, that would come in and say, hey, this is how you clean your house, and this is how you cook, and this is how you maintain a house. So those are two of the needs that we see at this time.
So that's, thank you, Caroline, for talking about those needs. And I would agree, we have, at Family Promise, I say that probably 75 to 85% of folks have a struggle probably with some kind of mental illness, and
Yes.
that is a disability. And so there is permanent supportive housing that has wraparound services. And actually that has been increasing in our region. Primarily People Incorporated has been able to get dollars that help that. But they have to find, just like Section 8 housing, everybody on here may understand, but people get a voucher, but they have to find the housing that will take that voucher. So the same thing for permanent supportive is finding the rental units that will work with that program. And that has always been a struggle. And now with the serious lack of affordable housing across our country, and particularly in our region, that's really hard to find those places. But I think there are a lot of people who need that permanent supportive, that they can live by themselves. They can take care of themselves to some extent, but they need that support to get to appointments, to keep up with
Yes.
stuff that they just cannot do. And even with time may not be, and mentoring, etc., may not be able to do that. But I think there are few programs, and it would help if there were more to help people to maintain their house. I like how you said that, because I think that's so true. And we've seen generationally probably that a lot of that was lost. And after it goes through several generations, people just don't have that as part of their framework to that you pick up stuff off the floor or whatever. And certainly here, I'm sure some of the folks who are on this call are thinking, my clothes are on the floor. Anyway, so yes, I think more programs that would help with that as people getting housing. And the other, with Family Promise, we are able to, and actually it's required for some of the funding help, that case managers continue to work with people once they're in housing to help maintain that housing. You can't just put somebody in housing and assume, oh, it's all good because they have a roof over their head. So.
Right.
Anyway, also I wanted to, you talked about warm clothing and coats, etc., and with helping with some of this work, it's just something you don't even think about. I've got my jackets and my winter coat from last year that I get out. If you're without a home, you can't keep a winter coat from year to year. So that means we have to get coats for everybody all over again, because they can't carry a coat
Right.
through this hot summer months and have it ready for winter. So
Yes.
it was just kind of an aha moment for me to think, oh,
Yeah.
wow, something to think about, that every year all these folks. And what we talked earlier, what about how many people are y'all seeing and feeding meals on Mondays and Fridays?
We are averaging probably 60 to 65, somewhere in the low to mid 60s on average. We do have peak days where we top out, close to 90 people. But that we have noticed that that's closer to holidays, or even when it's a little bit colder. And the crazy thing is, even when it's a little bit warmer, and I think that more people get out when it's a little bit warmer. Um, you know, I, I think sometimes on the colder days, they just stay put.
If they're able to have a sleeping bag or lots of blankets, they're just going to
Yeah.
stay
Yeah.
under, just like some of us would like to too. It's no
Right.
different, right?
Yeah.
For wanting to stay there, it's very different to get up and get out and be cold. So,
Yes. Yeah.
anyway, yeah, so I guess I think you've already said it, but things that would be helpful for what you see, and you talked about more support for people and more affordable housing. So are there any other things that would help Proverbs 3:27 with partnerships or with actual donated items or volunteers, as well as the situation as a whole?
Yeah. We don't know an exact date yet, but one of our main volunteers is getting ready to probably have some surgery, and we'll probably be out at least a month, maybe a little bit longer. And it is our van driver, so we will probably have to pull, some of our other volunteers to drive the van, and so we will need volunteers. Um, I would say probably February, March, in that area. And we, so we definitely could use volunteers. We always take clothing donations. Men's clothing seems to come by harder. It's harder to get men's clothing. And the men that I've talked to, they're like, well, I never clean out my closet, or the fact that they wear out their clothes, I mean, so men don't have as big of a turnaround on
I
clothes.
think it's also just, I hadn't thought about it, but women's clothing tends to be more, like I can wear from 3 different sizes depending on
Yeah,
the item.
right.
And pants, if they're stretchy, whereas men, it has to, like jeans, they have to be the right size.
Yes.
So having in stock the right size for that person at that time can be a challenge.
Yes.
All right, I'm going to stop it there, um, and get back to our group and to thank Caroline. We had a few more minutes of conversation back and forth, so just going to go ahead with that and give us a chance to see if there are other questions for Caroline. And Kay, good to see you. You did get in, yay, for whatever reason. There might be others who couldn't get in. So see if there are any questions for that we can pass on to Caroline to share. What do y'all have for any comments or questions? Silence. I assume y'all can hear me.
Is there a particular difference between like them and the thing that Anchor does? I know Anchor's Tuesday, Wednesday, Thursday, and like Anchor does showers and laundry, I think.
Right. And they've done warming center too,
Right.
that they did. So no, I think it's probably similar.
Okay.
And also that they're faith-based. So Family Promise has certainly comes from a faith. That's how it got started. That's a component, but on that 501c3, we do not check off being faith-based. So we don't have a chapel component or anything as part of our program. So, and I think both of those do. So, but otherwise, and for the difference with Family Promises, we have social worker case managers who work with people, and we get referrals, like Caroline said, a lot on the Tennessee and also on difficult case management cases. So Family Promise gets some of those. Other questions or comments? If not, then we'll thank Caroline, and sorry she can't be here, and Lynn Pinnell who is Bristol Housing and comes sometimes, is there this morning doing the pit count, which is going on. It is where did you spend the night of the 23rd, 24th. So those questions are still being asked. And to get it to be the same day, it's that one night, no matter when you ask, that's when it is. So with that said, how about Christina Blevins? Why don't you, since you're tied into the pit count, I'm going to call on you first.
Hello. Can
Hey.
y'all hear me?
Yes.
My computer died. So I am using a makeshift computer. So excuse me if I look at the camera and I look at the screen that you're on. Yes, the point in time count has started. It's kind of weird here in Bristol because obviously we have two different organizations doing the pit count. Appalachian Regional Coalition on Homelessness is our Tennessee side, and that is your continuum of care. And then on the Virginia side is People Incorporated. But both the homeless shelters in Bristol are on the Tennessee side. So we seem to get, obviously a lot higher numbers here for the pit count than Bristol, Virginia. We won't know for a month or so what the final count is, maybe even more, depends on when Arch gets it to us. But usually in the past, on the Tennessee side, it's about 114 to 120 individuals. And then on the Virginia side, I don't see Ellen here, so I'm gonna tell you this, but it's about like usually around 20 or 25.
Yeah, and just in a second, I can tell you how many unique individuals we saw at Family Promise Day Center, but I believe it is like 741. So we can really look at how that's, and most of those, I'd say you could take out, maybe being generous, you could take out 40 that are housed but come to the center for whatever reason.
So HUD looks at homelessness a little differently than you guys probably do, Margaret. They look at homelessness like if you're staying with a friend or you're staying with a family member, that does not constitute you being homeless. I literally have to be on the street or living in your car to be able to count that as a homeless person for HUD.
Which is different for the school system, which
Right.
Kate's on, which they do count people couch surfing. And it would be nice if those were the same. I assume a lot of that is because it is very unsafe for children to be couch surfing with different adult individuals, et cetera, so that they look at that closer. But I will say that I would think those unique individuals, 95% of them meet that criteria. They are not, well, no, yeah, they're either in a shelter or in the car or on the street for the ones that we're seeing. So
Also for the Bristol, Tennessee program, we run what's called the Northeast Tennessee Virginia Home Consortium, and we are awarding let me get to the numbers, approximately $3,412,607.20 to the Bristol Redevelopment and Housing Authority. So that's the Bristol, Virginia Public Housing Authority, to build 12 new 1 and 2 bedroom rental units and supportive services and nonprofit capacity building for the people that will be receiving the additional support. So really proud of those guys. Congratulations. And we hope to get that project moving forward here in 2024.
So, and I'll just add, yes, it is very exciting. Which housing anywhere is exciting, but it was Johnson City, Kingsport, Sullivan, and Washington counties and Bristol, Virginia, who were eligible, and Bristol, Virginia received it. So very exciting. And also they are working on another project with 22 units. So with the need, that's a small amount, both of those added together, but that's how you climb the mountain, is one step at a time, or 12 steps at a time, or 22 steps at a time. So we're excited about those projects. So, Christina, anything else?
No, just crazy. Trying to get everything ready. We've already started stuff for budget for fiscal year 25. So if you have a special request that you would like to get into the city for funding, please go ahead and get that moving.
Oh, that's right. That's me, and I forgot about it after you told me. So everybody pay attention. We've got to do that. Okay, so does anybody else from housing, the Bristol, Virginia housing? I'm looking to see who I'm missing that might be able to add in. So, all right. Nikki Robertson, do you want to chime in? And I don't know if you're able to talk a little bit about the harm reduction. Are you able to unmute and be there?
Yes, I'm here. I have been volunteering. Excuse me. I wasn't expecting you to call on me, Margaret.
I'm calling on everybody. Sorry.
Okay. I have been volunteering with Family Promise since October, and it has been such a wonderful experience for me. I initially started doing it to get my certified peer recovery specialist hours in the state of Tennessee. But I got those hours in November and continue to go to the day services at the Salvation Army 1 day a week. As far as harm reduction, what are any specifics you want me to speak about? Or
Yeah, can you talk about the ETSU program? Or is that better to share later?
the ETSU program that comes to Bristol once a month?
Yes.
Okay. So in my research, I found out that there's a program through ETSU that brings a needle exchange to Bristol once a month. They are currently located at the Bristol Frontier Health building in the parking lot. And they're available in Johnson City at ETSU's infectious disease building. In Johnson City, I think they're open 2 days a week. And then they are also doing community outreach work in Johnson County and different areas for needle exchange. The importance of needle exchange is that, and harm reduction in general, excuse me, is that it increases 5-fold the chance that the participants will go to treatment. And I actually know people who are working in our community and making a huge difference that came to recovery through a needle exchange. So I know it works. So also with the needle exchange, they offer Narcan and fentanyl strips, xylazine strips. If any of these terms are unfamiliar to you guys, please reach out to me. These are just substances that we're seeing in our community. So.
Thank you. And I have a flyer that I'll try to send that out when I send out the chat and more information. I also put the YouTube channel in the in the chat, but I will send that out by email as well. So thank you, Nikki, very much. And thank you for volunteering with Family Promise. It's awesome to have you.
Thank
Emma,
you.
first time here from Appalachian Girl Scouts. If you want to share, introduce yourself, share.
Hello. Sorry, can everyone hear me?
Yes.
Okay. I had trouble with my microphone earlier. Yes, I am from Girl Scouts. I am a relationship manager, so it's my job to kind of help new troops get started, help get Girl Scouts out in the community, and kind of support volunteers with whichever problems they're having, whether that's just finding activities for their girls to do, or if there are more serious problems within the troop, I kind of help mitigate that. Right now we are heading into our spring recruitment season, so I'm just trying to get into schools, community centers, places where girls and their families are, to kind of teach more about Girl Scouts and what it can do to help their girls. So we, right now we're working on planning a skate day at Skateway Bristol for girls to bring their friends that might be interested. And then the families can come and kind of learn more about Girl Scouts. And we have a few more events coming up. And then, of course, it is the beginning of cookie season right now. So you'll start seeing the girls out in your community in the next few weeks. So support them if you can. Buy Girl Scout cookies.
Great. Thank you. I assume you welcome donations too. So
Yes, yes, we have a our donation partner is an organization that donates cookies overseas to people that are serving over there. So
okay. Andrea, United Way. Thank you very much, Emma, and welcome.
I have a question for Nikki, and I just need to clarify some information that she shared. Nikki, did you say once a month?
Yes, once a month.
Bristol at the Frontier Health, is that right?
Yes, it's in the lower parking lot. They set up a tent, like a, one of those tents, and operate out of it.
Okay, thank you. And I just want to echo, my daughter-in-law lives in Brooklyn, New York, and she did harm reduction. And it is evidence-based that when you do needle exchange along with some other things, that it does increase clients going into treatment a lot sooner. So I will echo that from my daughter-in-law in another state who has done that same type of nonprofit work. So, but I'm Andrea. I am the resource coordinator with United Way of Bristol. And the big program that we still have going on that we are pretty excited about right now is our transportation gap grant. And it provides transportation to those who are working to get to and from work. And so last year, from February to December, we provided about 670 rides. And that is usually within about a 3 to 5 mile radius, just because of the grant cost and requirements. And so we are continuing that program and looking for funding to continue that program. And we're really excited about it. And that's probably about all. That's about all.
So thank you very much, and thanks for your words about the harm reduction. We know it's one of those very, a lot of people don't realize what the evidence shows for how successful it is, and don't believe that helping people in that way helps, really changes anything. So thanks for sharing the information about the evidence base. And I will get a poster, a little flyer that has I think it has the times for all 3 locations in the Tri-Cities. So we're pretty excited that that's available in our community. Cindy, Rocket, if you and Brooke want to weigh in and talk about your new program that to understand it a little bit.
Sure. Good morning, everybody. Brooke is on the phone right now and taking care of some patients. So,
Okay.
Thank you, Margaret, for combining us. So,
Okay.
Crossroads is, for those of you that don't know, we are both a mobile medical clinic and a freestanding clinic that provides primary and urgent care free of charge to the folks who come to see us. And basically uninsured is our target population. So we see lots of folks downtown. We're right by Bristol City Hall and the police department. And we have just recently purchased the abandoned, there's Brooke. We have abandoned, no, not yet. We have not. We have purchased the abandoned, oh my gosh.
Parsonage.
Thank you. I'm thinking, yeah, every word except parsonage was coming to me. Parsonage next door. And we are in the planning stages of making that a behavioral health and wellness center. So that we aren't sure how long that will take, but one of our nurse practitioners is getting her behavioral health certification to work into the partnership of our mental health and primary care programs. So in part of that, so if you all know anybody, we are also about to begin advertising for a job opening for a position in for a development person for Crossroads Medical Mission. So I know I rambled on, but we are busy and we are happy to help anybody that you send our way. And thanks for everything that you're doing. It was great to hear from Caroline as
Good.
well today.
Good. I know sometimes people are too busy to even tell us what they're doing. So
Yeah.
Brooke, do you want to add anything to that? And I'm curious with the work that goes on at Family Promise and what we know for mindfulness and for PTSD, which is what a lot of our folks who have ACEs and trauma, it equates to PTSD. And the treatment for that is not just sitting down and talking about your troubles. It's actually exercise and meditation, etc. So yeah, talking to see if you can add anything about what y'all anticipate.
I'm just really excited that, we have the ability to bring something like that into the downtown area because it's, I guess I had blinders on before I started working for Crossroads, and I didn't realize how prevalent the unhoused community was in our downtown, and that's talking from someone who's actually worked downtown for years. So it's just been a real eye opener. And I think it's something that we've needed for years. And I just feel blessed and fortunate to be a small part of it.
Right. Thank you very much and appreciate y'all. Okay. Who would like to go next that hadn't been called on? Giving somebody an opportunity to speak up. I'm looking at Sharon. Melissa, you just showed your face. Go ahead.
I did, yeah. We've got a lot going on, but I've tried to narrow it down to things that might be really useful and helpful for this group. Our parenting program will be starting an Attached at the Heart program in February. And sometime in March, we haven't scheduled the date, we'll be doing a parenting educator training. So if you know somebody who might benefit from becoming a parenting educator or learning a different system, we encourage you to take the classes first. So those start on February 2nd. All of this information, just so you know, is on our community calendar on our website, AppalachianPromiseAlliance.org. I will also say that the Northeast Tennessee Resilience Network, which was the Trauma Informed Care Network, but the group decided to change the name. We'll meet on Tuesday, February 20th at 10 a.m. via Zoom. And we're going to be talking about the community health assessments that have been ongoing in Northeast Tennessee and the 8 counties of Northeast Tennessee. So we welcome you all to that. A couple of things that are a little bit closer, but might be relevant for you all. There is a grant writing session coming up for those of you who need to learn more about writing grants, or you may know something, but it is a mini conference on Thursday, February 8th at Northeast State Community College. That flyer and information on registering is on our website. And then this Monday, the 29th at 10 a.m., Branch House in Blountville is going to be having their regular CCRT meeting. It's in person in Blountville, but they also have a Zoom link, and they're going to be discussing potential housing summit that addresses issues that domestic violence victims face when they're trying not to return to an abusive relationship. So that might be really a good thing for you all to attend, or to learn more about, or to share the information that you all have. And that's all I have, Margaret.
Thank you very much. And the AppalachianPromise.org has a calendar with lots of events on it. And again, we're going to send out a little bit, a blurb with information about some of the resources that we know are available, and others can share stuff as well. So Jamie Kincaid.
No real updates from me. We're still just trying to get a lot of veterans housed in the area. And of course, as you all know, there's not a lot of housing to be had. We have money to get them in, but nowhere to put them. If anybody's working with any veterans at all, or even families of veterans, if they have behavioral health needs or need just financial assistance or anything, feel free to send them my way. I put my contact information in the chat, but no real updates, still just plugging along here.
Time to do it. That's right. So thank you very much, Katie. And that's a great way to say that you're ready if you want to go. And then Amy Rasnick, sorry to be slow, you'll be next.
Great, thanks, Margaret. Can you all hear me?
Let's see, your volume is very low.
Amy, why don't you go ahead and go, and let me see if I can fix my sound real quick.
It's better, so keep on
okay.
working on that.
Okay.
Yeah, Amy, if you'll go ahead and go, that'd be great.
Thanks. Sorry.
That's okay. And Amy, you're muted, yeah.
My name is Amy Rasnick, and I'm with Communities and Schools of Appalachian Highlands. As you know, we place student support coordinators in school buildings to connect students and families with needed community resources. So we make referrals to a lot of your agencies already, and we're tickled to learn about new ones. But one of the things that we are really pushing right now is we received a grant from Anthem Elevance, and we are working to raise awareness about mental health challenges and crisis, and about ending the stigma around mental health. So I have become a certified adult and youth mental health first aid trainer, and we would be happy to come and train volunteers or staff or parents. These classes usually cost $175 a person, but we can offer them for free right now. So it helps people know how to help someone who's experiencing a mental health challenge or crisis. You learn the signs and symptoms. There's an actionable plan you can follow to assist them and get them help.
Awesome. So if you have any schedule, let us all know and get that out, as well as people requesting. So Katie Long.
I think we're better now. So I'm with the YWCA in Bristol, and I'm glad to see so many familiar faces. This is my first time joining for this meeting, but I know it's not your first time seeing YWCA staff on here. So I'm working with a program called the Family Network, and we're providing wraparound services to the low-income families in our area. And we've started kind of with our in-house families, sort of bridging the gap from some of our core programs in childcare, in teen pregnancy support, and in the STEM program for girls. So we're kind of bridging the gap, able to utilize TANF funds to do that. And so I'd love to talk more about the program if anybody wants to reach out to me directly. But some of the events that we have coming up that may be relevant for this group is coming up on February 21st. Becky Haas is going to be coming and doing an in-person basic trauma-informed care training. As I shared yesterday with some of you all, that space is limited, but I'm very happy to share that with our partners and community support. So if anyone would like to attend that, please reach out to me, and I would love to get you more information on that. And also following up kind of on Amy, and I've been working with Nikki Robertson on putting together a panel on breaking the stigma of substance use. And what we're looking to do is kind of pull together a panel, a discussion session where our families can sit down and have some just some really hopefully frank conversations with those who are certified peer recovery specialists, those who are working in the fields, just really, again, breaking that stigma on substance use in the area and how that affects a lot of our community. And so we're planning that for April the 23rd. It will be a daytime session. And plans are still underway as to who's going to be involved in that. But if you are interested in that topic, if that's something that you would like to work with us on, I will put my email in the chat, and I would love to talk to you. So thank you, Margaret, for the chance to share, and everyone for all the really good updates.
That sounds great. That sounds very interesting. Okay, we're not out of time yet, and if people will stick around just for 3 or 4 minutes. Jennifer, you've been patient. Kay, patient after Jennifer, and then we've got Lindsay and Danielle. You could and Sharon. Oops, Sharon. We've got a few more. Go ahead, Jennifer.
Hey guys, I'm Jennifer Jolliffe. I work with Molina Healthcare. We're one of the managed care groups with Medicaid. On the Virginia side, if you're working with any Virginia families, it is time for open enrollment. So if for whatever reason they're not particularly happy with their current MCO, it is their time that they can switch that out. There is a new comparison chart. Margaret, I don't know if I sent that to you or not, but I can get it to you.
Okay.
That started first. So it's got a few changes on it, nothing too major. I also am a volunteer with Lions Club. I run the sight and hearing unit for Lions International 24C, which provides free vision and hearing screenings. So we will be at the YWCA on February 9th, providing screenings from 9 to 11. That's open to the community anywhere from 6 months through adulthood. And we're also going to be offering colorblindness screening, which is something new that we've not offered before. So we're excited to get started with that. We had somebody ask us about it a while back, and nobody really ever mentioned it to us. So we're trying something new and something that's desperately needed in this area. I know, just putting it on my Facebook, asking people if they would look at this stuff for me. I had several friends that were colorblind, and I had no idea that they were colorblind. John Seaborn, and a lot of you all probably know, he does a lot in the community. He's almost completely colorblind, and I had no idea. And I've been doing vision screenings with him for 15, 20 years now. So you learn a lot about people in situations like that. But if there's anything that I can help you all with, feel free to reach out and let me know. Thanks.
Thank you. Okay, Kay.
Hey, okay. I just have a couple of things to mention from Bristol, Tennessee City Schools. We are about to launch a new attendance challenge, Be Present attendance challenge. We did this several years ago. It was very successful. And while our attendance is good at this time, we certainly want to stress good attendance at school, as well as the elimination, as much as possible, of tardies and early withdrawals. So our focus this time is on be at school every day, all day. Our community, again, has been incredibly supportive with this effort. You're going to be seeing Be Present attendance challenge signs, yard signs in many of our businesses and on some of our marquees, just as a reminder that good school attendance is incredibly important. Also, on February 16th, Lynn Pennell and I will be co-facilitating a poverty simulation for Fairmount Elementary School and that staff, the Fairmount Elementary School staff. And we also are going to have some communities and schools folks there. We are in need just of a few more volunteers. If you would like to volunteer to work in the town of the poverty simulation, we would certainly love to have you. So you can contact Lynn or you can contact me and we can get more details to you. Thank you.
Thank you, Kay, very much. Sharon Dixon, if you're still there patiently.
Oh, I am. I just want you remind everyone to please check your smoke alarms and all. We've had over 30 fires just this month, and we still got a couple of days left. And we had a family that had a fire yesterday morning at 6 o'clock, and the only thing that saved their lives was the smoke alarms. So it's very important about that. And the Red Cross does it throughout the country. Over 2,000 lives saved now. So if you know someone that needs smoke alarms, does not matter on the income, they can go to redcross.org to sign up for smoke alarms. So thank you, everyone.
Right, and share that information with our clients and people we work with. So that's great. Thank you very much for being here, Sharon. Lindsay McNabb?
Sure. Can you hear me?
Can.
Hey, Creekside, I work with John Knack and Jeff Williams, and all the things everyone said on this call is my history, taking care of trying to stop the stigma and drug abuse and helping patients with mental health and substance abuse problems. On last Friday, January 19th, we opened our additional 24 beds at Creekside. We had the ribbon cutting. The bad weather kept people away, but we still had a great turnout. So now we have 96 beds to help children 9 to 13, 14 to 17 in mental health crisis. We help adults that need mental health. We help adults that need help with stabilization from drugs and alcohol. And we also have a senior unit. So I just wanted to keep that simple. We also have vans that go anywhere they need to go. Yesterday, we did 2 trips to Children's Hospital in Knoxville to pick up kids in crisis. We went to Mountain City to pick up children. So just know that Creekside now has an official transportation department, and I'm so excited because that just makes it easier to do God's work and help more people.
Thank you very much. Thanks for sharing that. And the transportation is, we know, critical. So last, I think everybody's had a chance. Danielle Hahn, just introduce yourself, say hello, and then I think we're good.
Hi, Danielle Haney with the United Company Foundation. I can't thank you enough for allowing me to just sit in and listen. It's amazing to hear all of the wonderful things that you guys are doing for the community.
Thank you very much for being here, Danielle. We appreciate your taking time to be with us. It's awesome. So, okay, does anybody, I have one other thing to add. Just it'll hopefully go out with Gary McGow. Hopefully everybody's on Gary McGow's. I'll add that to the list to be sure that we do that when we send out. Salvation Army is looking for a Family's First case manager. So hopefully that ad will go out through Gary McGow before long. But if y'all know of anybody looking for a position, and Salvation Army does offer benefits with their positions. So anybody, anything else? If not, we'll say thank you very much. And our next meeting is February 23rd. No, at 11, and then again, the Bristol Coalition, February 13th. And I know a lot of you are on Lynn's list. I also, for Bristol Coalition, I try to send those out. She gets them out usually Friday. I try to get them out Monday. Sometimes it's last minute, but so that you know about those, that group as well. So thank you very much. And I hope you have a great day and a great weekend. So take care.
Thank you.